Good afternoon and welcome to United TV and Bariatric Friday. My name is Kemal Erkan. Today we are gonna discuss another really important topic, and this is gonna be how to keep off the weight loss for good for a long time. And Dr. Irgau is gonna join me, and then he's gonna be our clinical expert, and we are gonna discuss this with several different questions that we have. For those who have not watched any of our prior episodes on our channel, there are specific playlists. You can always go there and watch the prior episodes with the same topic or any other topic that you would like to go over again. That would be available for all of our patients and everyone who wants to learn more about morbid obesity and fighting morbid obesity. So, Dr. Gao, welcome back. How are you?
Very well, Kamal. Thank you.
So today, I have the great pleasure of sharing your book. This is what we have discussed before. The Tigrayan Electrician. This is a book that you wrote 2 years ago. It was published, and this is the Turkish version of your book. Because of the market, we had to use a little bit different background to see if we are able to reach out to more people there. And now this is available in Turkey. I know you are working on the Italian
and
edition
Tigrinya version, yeah.
and Greek.
And Tigrinya.
Tigrinya, actually. Yeah. So those are Italian is ahead, I believe.
Yeah,
right?
the Italian is
so
yes,
they should be coming out, and then we'll be doing more promotions in Turkey when I'm there after the 14th. So thank you for doing this.
Thank you, Kamal. I know that to do this translation, you put a lot of work, and to get it done in such a rapid manner, have it printed, it required a lot of attention, a lot of work. So I really want to thank you. And for me, it's a real privilege to have the Turkey language to be the first one to have my book translated. So thank you again. I really appreciate it.
Well, thank you. So going back to bariatric and morbid obesity and our fight with morbid obesity. So the bariatric surgery triggers a great rapid weight loss, but maintaining weight loss, maintaining this loss is, especially for the long term, can be challenging. So studies show 20 to 30% of the patients may regain some part of this weight loss again in the following 5 years. Mm-hmm. So the question is, what can we do? I mean, why do some patients regain weight after initial losing so much post-surgery? What are the main reasons, and what can we do for this?
Absolutely. So this is a very important topic, and we've touched upon it before, but it's important for us to revisit again. First, let's just be very clear. Bariatric surgery is still the most effective treatment we have for morbid obesity, mm-hmm. without question. And yes, even with this effective treatment, weight regain can happen. Now, it's important to qualify weight regain. We're talking about significant weight regain. Some weight regain may be very common. For instance, if you take somebody who is about 5 foot 5 inches in height, and they came to us when they were about 250 pounds. They wanted to lose 100 pounds. They have bariatric surgery. They have a sleeve gastrectomy. A year and a half later, 2 years later, now they are 150 pounds. Mm-hmm. Perfect weight, perfect body mass index. They love it, right? But over some time, they can regain 10, 15, 20 pounds. Now, if they, in the long term, can maintain a weight of 170 pounds, they are still a success. Mm-hmm. They're not thin like they were at 150, but they still are very healthy. So that's not the type of weight regain we're talking about. We're talking about significant weight regain. So in our example, if that person was to regain weight so that now their weight is over 200 pounds, that is significant. And the question is, first of all, does it happen? Yes, right? Now, and that tells you that even with the most effective treatment we have, obesity is a very tough opponent, right?
It is.
It is very challenging.
Definitely.
So you've asked, why does it happen? Well, there are a number of reasons. First of all, the small stomach that we create, for instance, after the sleeve gastrectomy, or the small connection that we create after gastric bypass, they can stretch to some extent. They will never go back to the original size, but the stomach can become, for instance, a little bit less resistance, more compliant, more accommodating, right? And that can lead perhaps to bigger portions. People can go back to old habits, slider foods, high calorie beverages, right? All things really that can lead to a gradual and slow increase in energy intake, in food intake that will lead to weight gain. And of course, we cannot forget that obviously psychological challenges, particularly when people go through tough times, whether it's because they've had a loss in the family, they lost their job, they got divorced. These are huge, impactful stressors that they may run into the comfort of food very quickly. And very often, when I see patients that have regained significant weight after many years after bariatric surgery, invariably patients will have encountered a stress that has really pushed them into that direction.
Excuse me. Thank you, Dr. Gao. So now my next question is the issue around the nutrition and the role of nutrition with weight maintenance. So what are the most common nutritional mistakes patients make after bariatric surgery?
Yeah. Well, one of them is to really skip their protein goals, for instance. We talk about how important protein intake is after bariatric surgery because all of us require a minimum amount of protein intake, right? Now, with bariatric surgery, you are diminishing the overall size of their meals, right? The amount of food, the volume of food they can eat is very, very small, right? So within that, they still have to maintain a certain amount of protein intake. So if they really don't watch their protein goals, that could be one of the mistakes that you could make. Going back to sugary beverages, empty calories, whether it's sodas, juices, or God forbid, alcohol, those are things really that are a major mistake. Grazing is another one, right? They cannot eat a big meal, but if they continually eat during the day, like continually having something to bite and to munch through the day, which we call grazing, that also can result in a significant calorie intake that over the long term, obviously that can lead to a problem. So it is important for them to stick to what we teach them. In other words, to make sure that their eating is structured, eat in a structured way, in a planned way, rather than mindlessly, right? Secondly, they have to make sure they have adequate hydration, and also their protein intake always takes priority.
So the protein intake is important because, as you mentioned, it preserves lean muscle mass, which is critical for metabolic health. So now if you can kind of elaborate this a little bit more, why protein is so important, for protein intake is so important.
So as you mentioned, it is related to preserving our lean mass, beyond the fact that many functions in our cells are actually based on proteins that do the actual work. So there is structural protein and there is functional protein, which is really essential for our health. Now, if we don't have enough protein, we may lose lean body mass, which is fat-free mass, right? That we lose muscle. Well, if that happens, actually we may end up decreasing our basic metabolic rate, which is essentially the energy that we consume when we're doing nothing. So, if somebody sits all day long, Kemal, they will still be consuming energy. It's called the basic metabolic rate, right? But that actually tends to go down if we lose lean mass. And if that goes down, it means that we're not spending energy, which means that whatever we're eating is going to be stored, right? And it's going to be stored as fat. So, and then there is also this reaction of the body that when lean body mass is lost, the body freaks out. It thinks this is a threat to our survival. So it instigates, survival mechanisms for intake of energy. So hunger can increase suddenly. So paradoxically, when we're losing lean body mass, we end up actually regaining weight, but the weight that we regain can be fat. So we can have much more fat than we initially had proportionally if we get into that situation. So to avoid that, it is important for us to have adequate protein intake. Most people should be taking about 60 to 80 grams of protein daily. So that should be really the baseline. For some people, it may be more based on their height, but for most people, that would be really what we are looking for. So that's why this is important and why we emphasize on it so much. And then the other thing that is important also is that clearly when people eat protein, they tend to get fuller quickly. And that fullness actually tends to last longer as well. So they tend to graze and eat throughout the day much less if they're taking protein first.
Absolutely.
Yeah.
So physical activity is one of the elements is non-negotiable for us. So physical activity is linked with improved weight loss maintenance in both surgical and non-surgical population. So how does regular exercise impact long-term weight maintenance after bariatric surgery?
So bariatric surgery will reset our metabolism, right? It will get our metabolism to be at a different level and respond differently. That's why we end up losing the weight. But for us to maintain the weight loss in the long term, we have to be physically active. This is very important. In fact, it is important to understand that when you exercise doesn't help you much in terms of losing weight. But what exercise does is it helps you to maintain that weight. Right? So in the long term, we want our patients to be physically active because it is so important and critical for maintaining weight. But there are other very important advantages of exercise. For instance, it's good for our mood, right? If you're stressed out and you feel like going for that piece of chocolate, right? Why not go to exercise, right? That will take care of the stress. But also on the flip side, you avoid going back into bad eating habits as well. So boosting your emotions in a positive way is another very important advantage of exercise as well.
So the many patients and many people, they kind of battle with physical limitations, fatigue, or the lack of motivation. What advice would you give them who struggle with staying active, especially for post-op?
Yeah. So that's an important question. It comes up very often. When we talk about exercise, the number one rule is emphasizing on movement as opposed to having a sedentary life, right? So yes, going to the gym, exercising is good and we like it, okay? But first we have to do the basics. The basics is how often is that person up and walking around in their waking day, right? The foundation of all movement is walking, for instance. And now we have wonderful technology that allows us actually to measure our steps without having us to literally count our steps, right? We can have a smartwatch, we can have a smartphone on us, and they will tell us how much movement we've done, right? So that kind of basic movement is important. Now, there may be people who have limitations because of joint pain, back pain, and then other physical limitations so that they cannot do a lot. Well, you don't have to do a lot. We want you to do what you can. A person may say, for instance, you know what, I cannot walk for 30 minutes. My knees will hurt. Okay, well, walk for 5 minutes, rest, and then walk again. Rest, and then walk again. That is the key. So movement is what we want to emphasize. And also we want to emphasize the fact that we don't want people to become athletes overnight. In fact, we don't advocate for people to become athletes. If they can, good for them. But our job and our goal is not to make our patients athletes. Our job and our goal is to make them active people, right? From the moment they get up from their bed to the time in which they go to bed. How active have they been? Or they've been sedentary. So small things, small steps, build on them slowly. Now, there are exercises that can be done whilst you're sitting on the chair as well, right? If you're moving your legs constantly, if you're moving your arms constantly, that by itself is exercise. So being conscious about movement as a whole, as a foundation, that's what we are looking for essentially. Beyond that, obviously, we want people to engage if it's possible. If they don't have physical limitations, we want people to really have a habit of going to the gym 3 to 4 times a week to do both aerobic exercise as well as resistance training, which are very, very important.
Right. Or they can get a puppy from Brandywine Valley SPCA, and they are forced to walk on a regular basis.
Absolutely.
So actually, that's probably the best way to do it anyway. So many bariatric patients, they have some underlying food addiction or use food to cope with stress. So how do emotional eating and mental health impact weight regain?
So, as I was saying earlier on, these things can be intertwined, right? It is important to emphasize mental health as much as physical health, right? And our mental health can be impacted at different times of our lives, depending on what happens in our life as well. We have to be able to have coping mechanisms that don't rely on old habits, right? Of course, trying to find comfort from comfort foods may have been something that we have done in the past, but that got us into problems. It didn't solve our problems, right? Because we can eat our chocolate, we can eat our ice cream, but the problem will be there again afterwards. And we will feel terrible because we've eaten that chocolate afterwards because it's not helping us, right?
Physically and emotionally.
And more emotionally. So it is important to realize that we are all human. We're not superhuman. And every one of us is vulnerable to having struggles from a mental health point of view and from emotion point of view. So finding help is very important, particularly many of our patients who struggle with obesity for many years do struggle with mental health issues as well. And as you correctly said, there is an intricate relationship between those emotional struggles and their relationship with food. We want to separate these two. We want to get these two untangled completely. So eating is a different function. It has nothing to do with trying to cope with stress. Coping with stress should have other outlets, and that's where we want to help. How? Get counseling, come to us when you're struggling, or go to support groups where you can have shared stories with others, where you can have people understanding the struggles you're going through, and then get suggestions on good, valuable solutions as opposed to falling back into old habits.
So the support group is essential, and
It's
we
very
do
important.
have we have two ways of doing the support group. One is you can go to CHRIAS.com, and on the top right you'll be able to register for our monthly support group, or you can go to Facebook, and again through CHRIAS you can become a member of the bariatric support group. Both of them are private groups. We do monitor them, and there are a lot of good things being shared among the patients. Their experience, positive, negatives, they're all there. What they have done to overcome those problems. I think it's a great way to see that. I mean, it's a great way to get the information, I would say. So I would definitely encourage our patients to utilize the support groups.
Absolutely.
Now, the clinical follow-up and some other red flags that we want to talk about. Many patients, they stop seeing their surgical team and right after the first year. And I know you may remember we are doing a study, and my summer intern, Zoe, hopefully she'll be back next year, but we'll do some more work in between this summer and next summer. So a lot of patients, after a big weight loss, they stop following with the surgical team. So how often should patients follow up with their bariatric team after surgery?
So earlier on, In the first year, the visits are fairly frequent. As we said before, for instance, right after surgery, we will see our patients after 2 weeks, then we will see them after a month, then we will see them after 3 months, and then we will see them every 3 months for the first year and a half. After that, we will transition to seeing them yearly just for a regular follow-up. And of course, we're open to see them in between, of course, for any reason. So our patients need to be patients for life, meaning we want to see them even 5 years, 10 years, 15 years later, 20 years later. And believe it or not, we still have patients that we've operated on for 20 years ago that follow us on a regular basis. There are some patients that I know very well. November, it's their month. They will come every November. September, the same. August, the same. So they will come yearly to follow up. And those are the patients also who are doing well. And the reason is that follow-up by itself is very important, because during the follow-up, we are able to trace if there are early signs of problems. They may be nutritional deficiencies, for instance, because all bariatric surgeries are at risk for nutritional deficiencies, particularly when it comes to micronutrients like vitamins, like minerals, right? And we are able to check blood work on a regular basis and make sure that their levels are up to par. If there is any vitamin that they are deficient of, we are able to replace that in a timely fashion. So regular follow-up with us is not only encouraged, but it's actually necessary for them to stay healthy in the long term.
Now, we always say early intervention can prevent patient going through the wrong direction. So this can prevent small slips from turning into major setbacks. So what are the warning signs that patient is heading to the wrong direction for the regain?
Yeah, so, if patients are starting, for instance, to slowly increase their portions, right, rather than follow up the signs of fullness, right, slowly increasing their portion creep, okay? If they are grazing, as I said, if they are indulging into sugary drinks, if they are not taking their supplements, if they're not watching for their protein intake, if they're not exercising, if they're not weighing themselves frequently or as frequently as necessary, then these are signs that they could be going in the wrong direction, right? And it's important that when we see that we address that, of course, but for us to be able to address it, patients need to come and see us as well, right? So sometimes what I find, Kemal, is that patients will actually feel guilty when they kind of slide into this situation. They will feel guilty because they will feel as if they're letting us down. So they will avoid us instead of coming. But it's important for them to understand that we are not there to judge at all. We're there to help.
But
right?
do you think that we are judging them?
Well, it's natural. It's natural, particularly when we have been their coaches, when we have been celebrating their success, when we've been cheering them up and they were really happy about that. When suddenly they are falling off, then there is a feeling as if they are letting us down. Well, in a way they are, right? Because they are letting themselves down as well. But who doesn't, right? We can all struggle, right? And it is that time that you want to go to somebody that can provide help. We were there for their bariatric surgery when obesity was a huge challenge for them, right? We were not there to judge them in any way or shape. We were there to help. We are helping in the same way afterwards as well. So yes, we appreciate it when patients come and they want us to be part of their celebration when they're succeeding, right? We like that, but we like it even more when they come to us when they're struggling, because that's where we can give our best help to them. So it is important that when they are seeing these problems, particularly when they see the portions getting bigger, when they're seeing themselves grazing, when they see themselves indulging in sugary drinks or alcohol, God forbid, those are the times in which we need to be back in the picture much more strongly than before.
And there's also in some of these, social media has some impact. And I don't know how many people do on this, but I'm not just talking about for bariatric related stuff. or morbid obesity related stuff, but you can always block them. There are
Absolutely.
some that if you don't want to see, because they will be on your feed, uh, because there is still, although surgery itself with the significant weight loss, it's helping many of those who are dealing with the depression. There's still the stigma issue that we have, and part of the stigma is coming from social media.
Absolutely.
And
Absolutely.
just block the channels that you don't want to see.
Absolutely.
Block the channels that are not good for you. I mean, I do it for different topics because I'm not interested in that person's opinion or
Absolutely.
that channel's opinion. I just block them.
Absolutely.
So clean up what potentially you may be seeing, because one or two bad social media posts can
Ruin,
ruin what you are going through. So, and it may trigger
Yes.
some of the bad habits.
Yeah.
So now there are some new tools and trends. Last week, Dr. Rahul Singh was here with me, and we discussed the weight loss medications, so such as Wegovy, Ozempic, Zepbound. They're kind of like overlapping names. There are a lot of advertisements. So, and you know this because I show you every time I take screenshots of what I see on social media. Every corner you turn around, it's just there's Manjaro, there's Ozempic, there's Wegovy, and it's now it's kind of just taking the doctor out of the picture and then just putting the patient in the decision-making spot and demanding these from us. And of course, there's no exceptions for our patients. So, and then we know that there are some good ways of utilizing what's available to us. Can medications like GLP-1s be used to support maintenance after bariatric surgery?
The answer is yes, right? We use GLP-1 receptor agonist medications like the ones you've mentioned actually in two situations in our bariatric practice. One is there are some patients who have bariatric surgery, and because they have such a resistant metabolism, they cannot go beyond a certain level of weight loss. And using the medication actually trips them over that obstacle. And then other patients are patients exactly like the ones we're talking about, where there is essentially weight regain afterwards, right? Now, these medications by themselves are not enough for morbid obesity. Well, no matter what the ads say, no matter what other people say, you cannot lose adequate amount of weight if you have morbid obesity just with medications, right? We've seen that. The most effective treatment remains bariatric surgery. But medications can be an adjunct, right? As I said, in situations like this, right? And we've used them, and we've used them very, very successfully. Now, we don't want patients to rely on medications without really making changes in lifestyle either. We talk about this. Any intervention that we do to combat obesity has to be supported by a foundational change in lifestyle, which means focusing on healthy eating and also regular physical activity. There is no way you can compromise on those issues. That is very important. But again, with that understanding, at least for a short period of time or for a limited period of time, using medications as an adjunct has helped us, has helped our patients greatly.
Absolutely.
Yeah.
All right. So my last question is, patients want actionable, real-life advice that they can follow. So if I were to put you on the spot and ask you 3 pieces of advice that patients should be trying to maintain weight loss after surgery, what would be those 3 things?
Well, the number one would be stick to your bariatric basics, right? What you've learned first, which is protein first, hydration, and avoid grazing, right? The second one would be move your body every day, right? Movement, 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 and we've emphasized. And then the third one probably would be never skip a follow-up, right? Your team is your safety net, so you have to make sure that you see your team on a regular basis.
Absolutely. All right. Well, that's all I have for today. Dr. Riyad, thank you for
Thank you.
joining us. I know these are important discussions that we have for our patients and for those who are fighting and battling with morbid obesity, maintaining weight loss, maintaining weight itself uh, comes with age, difficulties, gender related difficulties, social stigma. All those things are not easy to deal with. And if you are in the morbid obesity area, you really need to look for professional help. Having a first consult with the bariatric surgeon, regardless of you do surgery or not, this would be a good step, good first step to have. And then you can decide later on what's right for you and how you can claim your future again. So we are here and we'll be back next Friday with another topic. Thank you for watching us. And until next week, stay united. Bye bye.